The public health issues that face our communities are varied and complex. To effectively address those issues, the involvement of people from a variety of backgrounds, training, and expertise is required. In Minnesota, there's only one multidisciplinary public health organization that routinely mobilizes all these constituencies to work together to better the health of the public. It's the Minnesota Public Health Association. On today's episode of A Public Health Journal, we'll be talking about MPHA and some of the many public health issues with which the organization is actively involved. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at a variety of public health issues from the perspective of the Minnesota Public Health Association, the organization that represents the diverse group of public health professionals working throughout Minnesota. Joining us in our discussion today are two past presidents of MPHA. Carol Berg is the immediate past president of MPHA, and in her regular job is the public health manager for UCare, a managed care organization serving diverse members throughout the state. And Dave Golden, who was president of MPHA in 2012, and in his regular job is Director of Public Health and Communications for Boynton Health Service at the University of Minnesota. Carol, Dave, welcome to our show.
Thanks.
And Carol, you're the most recent past president, so tell me a little bit about the role that MPHA plays in the state of Minnesota.
It is really vital for us who are public health professionals in whether private sector or in the government sector that we can have a member organization that allows us to have an independent voice to support public health and engage citizens to make sure that we are working together with the communities in which we work and live, can support health improvement initiatives across the spectrum. And so I really appreciate having an organization which is all volunteer, we don't have any paid staff, that helps to support the work of people who do public health for their day job, but there are others who do that maybe part-time or as volunteers. But it's an independent organization because sometimes we need a place to have an independent voice in that where we work, we may have constraints where we can't speak up about policy or system changes in a way that we would like to. So this is a place to do that.
Tell me a little bit more about that independent voice. Tell me a little bit more what that might mean.
Well, because we are a 501c3, a nonprofit organization and a member organization for public health professionals, we can be very active in our policy and advocacy committee to be a place where people can bring issues of concern that perhaps we want to work on to bring to the legislature or support others who are bringing different draft legislation or proposed policy changes and advocate for that and lobby for that in a way that is not possible through their in places of employment. And so we are able to speak as a separate voice, and we can gather input and engage perhaps non-traditional partners in that advocacy work.
Yeah. Well, I know I like that as working for the Minnesota Department of Health, and the governor's cabinet. I do what the governor does, and his agenda is the agenda that we worked on together. And if something outside of that agenda we may not work on, but you could then work on, MPHA could work on that.
That's right.
And Dave, Carol mentioned that there's public and private. So you don't have to be a public health employee working for a public health agency to be part of MPHA?
No, as a matter of fact, Carol's not a public employee. Actually, you're even on the private side, and we have quite a few of those. Ken Bentz, for example, who's with Medica as their public health person, comes from essentially the private side. And there's already quite a few people from all over the place, even people that are just strictly volunteering, unemployed in completely different areas can be there.
Or retired.
Also, folks are involved, which has been, a huge asset to the organization. A lot of these people, by being volunteers, all of our capital for MPHA is all volunteer people. We don't own stuff. We're not paying staff other than the occasional intern. So it involves people from all walks that have figured out this idea that health should be part of everything that we do in terms of making decisions about policy, but also program creation, all these different things that go on. So it's really been a fascinating experience for me anyway, to see how these volunteers mobilize and do stuff and come from all over.
You know, and I can see how somebody from public health agencies, governmental public health, you know, want to be part of it. But what about, you know, UCare and Medica and Blue Cross Blue Shield, who have a little different focus? Why would people from those organizations want to be part of MPHA?
Well, it provides an avenue for people to come together. There are many, different initiatives going on, and sometimes you wonder, how is this all fitting together? So MPHA can serve as a facilitator to help support people who are doing their health improvement related work in their jobs or in other volunteer settings. They might be volunteering with other community-based organizations where we can be sharing resources across our program or sectors in order to make sure it is all aligning to achieve our common goals of improving health in many different areas across the state. And so MPHA can be a way to complement and support people in their public health practice. We want to really continue to improve how public health is practiced in the state. And of course, there are training programs and other things that might be offered through MDH or local public health or other entities. But we want to make sure if there are some gaps, for instance, in public health leadership right now, we are collaborating with MDH and the School of Public Health and other partners to make sure that since the Emerging Leaders Network training went away, that we are filling that gap with some other coordinated efforts to make sure the future public health professionals are well trained to be leaders and directors in public health. And so we can help to find out where are the gaps, how can we connect the dots, whether you work in the government job or private sector. And I'll just say, working for a health plan, it's really important for us to be aware of what are the resources available to our health improvement, quality improvement work. And that means partnering very closely with public health professionals that work in the government sector.
Yeah. Are there any criteria for being a member?
No, you just join. There's a $50 annual fee membership.
Pretty steep.
And you know what? That's by design. You know, this is not, we're all volunteer. And so it's not like this is a way of raising funds to fund some position, that kind of thing. And that low cost, or $25 for a student, for example.
Actually, it's 20.
Is it 20?
Yes.
Oh, geez. Which is a great deal.
Yes.
Just across the board.
So what kind of professionals are part of the organization? Is it mostly doctors and nurses or health educators? What's the makeup of the members?
Across the board, yeah. From environmental health, public health nurses, community health workers. We're really making an emphasis on doing more work with community health workers to make sure they're involved.
Physicians, we have nurses, we have researchers, we have community program specialists, we have people from the university involved. The dean of the School of Public Health is a member and active, as you'd expect. And then, like you mentioned, it's not just from certain sectors of the private sector, certain types of jobs. It can be anybody from the private sector that's come in to the organization because of just a pure interest. We have people that are in accounting that in some positions, and they're in because their regular job doesn't allow them to dip into the area of public health and doing other things beyond what maybe a more technical position would allow them to do. So it gives them kind of an outlet to go out and show up and do recruiting for public health, or even to be showing up for a day on the Hill or things like that. So we get a real diverse background.
And pharmacy.
Right. So it's a broad array. I want to talk about some of the specific issues that MPHA has been involved with, but first we need to take a little break. We'll be back right after this message.
Look at me. Hey.
Raymond, look at Mommy.
Maybe the light hurts his eyes.
Maybe she's just not hungry. Maybe he can't hear us. Maybe we're not stimulating him enough. Maybe it's a phase.
A Avoiding eye contact is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
Welcome back. We're talking about the Minnesota Public Health Association and its contributions to public health in Minnesota with Carol Berg and Dave Golden, two past presidents of MPHA. Before we talk about some of the specific issues, there was one thing I wanted to talk about is how does MPHA relate to the American Public Health Association, sort of the National Public Health Association? Dave?
APHA will appreciate that question. I think that we look at them as our parent organization. We're what's called an affiliate, and so we're part of a regional group of affiliates. And so we report we report back up to that organization, and we're part of that organization. So there's a number of ways that we interact. So one, they might help us with what policies should we be looking at in terms of what they want to promote nationally, and do we want to attach or participate in any of those specific issues that are happening in the national legislative areas? Should we be influencing locally and also getting people to write to their senators or their national leaders that about specific issues that we relate that way? There's affiliates that we take part in, or sections that we take part in terms of policy, and then we have representatives that show up to do the voting for the national organization as well. So it's a formal arrangement, as well as there's a bunch of informal things that happen with the organization as
Carol,
well.
are members of APHA also members of MPHA and vice versa, or are they independent?
They're independent, and so of course we mutually encourage. So APHA likes it when their affiliates encourage their state members to join APHA, and vice versa. We encourage people who are MPHA members to belong to APHA, just because of the various things that are offered as different resources to support you in your public health practice. It's helpful to belong to both. But so there's a lot of information sharing, and I'll say that we really do have a good relationship with, actually it's a regional group, the Great Lakes Public Health Coalition, with Michigan, Wisconsin, Indiana, Illinois, where we are working on policy-related issues with them, and that feeds up to the national level. And I'll say the Great Lakes Public Health Coalition is really well respected by APHA and is seen as a model to other regions across the U.S. And so I'll just say that group, for instance, just decided to work on climate change as a common policy priority. And so we'll help support policy issues and legislation perhaps that might be proposed around that.
Yeah, very appropriate, since climate change seems to be affecting the Midwest a lot more dramatically than many other places.
Very much.
Yeah. And Dave, before we get into specific issues that you've dealt with over the years, what has MPHA addressed? What are some of the highlights of things that they have really addressed in their 50-year, 100-year history, depending on how you count?
Should we go back to 1907?
Yep.
I didn't attend that annual meeting, but a whole bunch of stuff. So one is just resolutions about the marriage amendment, for example, that they participated in that. Or I'm trying to go back to some of the more specific things that they've done as far as policies or referendum passed. But when I go back to even health and all policies was one of the resolutions that the organization passed 2 years ago at the conference. That there's a number of things like that.
We've also partnered with organizations like the Minnesota Department of Health and Isaiah to, for the last legislative session, we were there as part of the press event to give more attention to passing that legislation around minimum wage. And we want to continue to work on some other issues related to that, such as paid leave from employment so that people can address their health needs. And so, but we also have supported over the years the legislation to support strong public health infrastructure funding. And so want to make sure we don't slip back on that.
Well, I know some, back many years ago, the minors' consent law that's in Minnesota was an MPHA push.
That was
certainly
huge.
At Minnesota Department of Health with our local public health agencies, MPHA was really important in that in the 70s in the Community Health Services Act that got passed.
Yep. Yep.
So Carol, when you're president for the year that you're president, do you get to choose sort of the issues that you want to take on, or does it just kind of relate to what's going on at the time, or how does that work?
It really is both, so you need to be sensitive to what are the priorities of the communities here in Minnesota and the local public health partners we have and others who bring, for instance, whether to the Policy and Advocacy Committee or to the Governing Council in general, what are key issues we need to work on. But it's also that the president can voice what their particular concerns are around. Usually they align pretty well too. So during the year that I was president, I really wanted to support the health and all policies approach, but we wanted to delve further into that. So that's why our conference just this June also built on that theme of all these different sectors that maybe don't traditionally think that they are working on health when in fact they are, whether it's transportation, water, or other environmental systems that need to be changed in many sectors. We want to make sure in public health we're building on the good work that's happened through the State Health Improvement Program approach that really is health and all policies in practice. And then also I already mentioned that MPHA, and a priority for me was to make sure we're building the future leadership of public health, because there are a lot of folks in public health director positions that are retiring now, and we want to make sure we're equipping new leaders coming into public health, and we want to recruit more young professionals into public health and support them to do their job well. And so that was a big priority for me. But Greater Minnesota participation is something we continue to work on. We're not a metro-only organization, even though sometimes it might feel that way, because that's where a big part of our membership base is. We're wanting to do more to reach out and have Greater Minnesota people participate.
And Dave, what were the issues that you took on during your presidency?
Two resolutions that went through was the health and all policies and the marriage amendment were big things then. I don't want to lose also tobacco, that we were already helping promote the tobacco tax increase that went into effect last year. So that was another big thing that MPHA helped push. And I was really interested in getting the conference back up and going to a 2-day conference, or a day and a half is what it ended up being, was a big deal for me anyway, because it was a way to convene everybody and address issues, especially one thing I really appreciated was when we started bringing in our partners, especially through the state. In fact, you were involved in gathering cabinet members together to bring them together to talk about health and all policies. And so all of a sudden you've got a transportation commissioner and maybe an education commissioner that comes in to, all of a sudden now they're talking about health related to their job. So just the act of convening a lot of times gets people to look at just what Carol is talking about, is helping infuse this idea of how my job, even though I'm transportation commissioner, has a lot to do with health. And we're talking about 0 deaths, or we're talking about helmet use, or we're talking about the way we're building roads to prevent accidents from happening, et cetera.
All right, well, I want to kind of do some crystal balling here, but we'll save that for the next section. So we'll be back right after this message.
Affects 1 in every 3 women in America, but you can fight back. There's no time to lose. Mothers, sisters, daughters, families, and friends, it's time to shout louder, stand stronger, and demand change.
Let's go!
To the Batmobile. Dang it.
To the invisible jet.
Dang it.
Together, we can put an end to heart disease. It's time to go red for women.
I could use your help.
Yeah! Learn more from the American Heart Association at www.goredforwomen.org.
Welcome back. We're talking about the Minnesota Public Health Association with 2 past presidents, Carol Berg and Dave Golden. In this last little segment, I really want us to kind of look at what are the public health issues facing Minnesota right now, the things that we really have to address, whether you're part of MPHA or whether you're part of business sector or the health sector or the public health sector. Dave, what do you see as the real challenges that face us today?
Public or opportunities. Public health has never been more relevant than it is now. I mean, it is so important now. So disparities are huge, and they're growing in many areas. health disparities, I mean, in our data at the University of Minnesota, when we look at statewide data, when we look at nationwide data, as those disparities increase, we've got a greater health problem. And paying attention to health as we head down the road, I mean, even where the U.S. stacks up in terms of infant mortality or other important health indicators, it's telling us, the data are screaming to us right now that public health and health has never been more relevant. It should be on all of our agendas, no matter what we're doing. So it's really important, and organizations like MPHA help further that agenda and infuse that concept into all we're doing.
Carol, what do you see?
Well, I would say just two things. That, first of all, that we want to continue to be involved. We've held a couple of different conversations around what is the role of public health and in community engagement in this new model called Accountable Communities for Health. And where the state improvement model will look at, innovation model will look at how can we deliver care in a more integrated, comprehensive way. But we know healthcare is a small slice in the pie in improving health. And so we need to also then, secondly, partner around addressing social determinants of health, which is a larger part of the pie that influences how healthy we are or not. And so we as an organization want to make sure that we are gaining synergy from working across different initiatives or efforts to both, yes, improve how healthcare happens when we need it, but more importantly, I would say, make sure that we're meaningfully involved in social justice issues and approaches that will really improve social determinants of health in a positive way to address the disparities in this state.
So you're actually talking about a different narrative about what creates health. I mean, the common narrative is if you just have good medical care and you make the right choices on what you eat and get physical activity, you're going to be healthy. But you're saying that it's a totally different paradigm. A lot more things influence health. How do you make that case, which goes against, and we spend 95% of all of our healthcare dollar on the treatment side. How do you change that narrative, that conversation?
I think we're going, well, I really do appreciate the narratives work that's going on under the Minnesota Healthy Partnership Collaborative, and MPHA is a member of that group, where there is a subgroup trying to develop new language that would help create a more dominant narrative. So we've got to replace old language of how we describe what the health problems are or why someone is sick with, in fact, what is going to create health, an opportunity to be healthy. You know, unless we change, the conditions where someone lives and create an explanation of how that does influence health, we're not going to make much difference, or to change the way people talk about health and what creates health. So it is coming together and figure out how can we be role models in talking about these things in different terms.
And Dave, some of the things that you mentioned really are related to policy changes that have to occur. And so how do you, in a really fractured society politically, people with different worldviews, how do you get policies that actually support health?
One, the data really help more than so many things to help make that case is a big one. The other thing is people generally want to do the right thing. Let's take paid maternity leave, for example, that you can cite that paid maternity leave can contribute to reduction in infant mortality. I mean, who's going to put those two things together really when you look at it? You need to get the language there where the data are supporting what we're saying. In education, the higher you go in education, you're going to improve longevity. How does that work? Same thing with income and raising the minimum wage. Ends up being health bills in many ways, or it's going to improve health. When we looked at the marriage amendment, there's important health outcomes that are going to be attached to that, especially as we look further down the road when people have access to care, better access to care through things like this that occur. Yes, they are policy, and a lot of times they're driven by data, educating the population and helping our population to do the right thing, which we want to do. We just need that information and that wherewithal to go ahead and do it.
Mm-hmm. And Carol, you mentioned community engagement and accountable communities. How does an organization like MPHA, which is people interested in public health, actually engage communities? Is there a place for communities to be part of this effort?
Well, that's part of why we have intentionally created a member category called community health worker. So that's one way we do it, is to involve more people who work out in the community and that come from communities that are very diverse, and they're helping to navigate the systems that people have to work within in order to address their health needs. And they've got many great relationships with different community folks, whether in organizations or just individual residents. But each MPHA member brings with them strong relationships with community members and consumers of health, or people who represent all the different diverse communities we serve. And so it's through those relationships that we hope to involve more community members.
All right, we've got less than a minute left, and we'll be putting on some contact information, email and website for MPHA. But anything you want the audience to know about MPHA in this last 30 seconds. Dave?
Join.
I was going to say, we need you. There's a place for everyone, and no matter what your background is, you do have something to contribute to public health.
Yeah, and our membership continues to grow, and it's just by people joining. Not much expense, and there's some great opportunities.
Yeah. And I know it's fun to be part of MPHA.
It is.
Because
if it's not fun, it's not public health.
Absolutely.
Right?
That's right.
Good. Thanks for both of you being on this. This was fun.
Thank you.
And I'll be back with a closing comment right after this message.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Although we have state and local health departments that are charged with providing a variety of public health services, public health is not their responsibility alone. Public health is the responsibility of all of us. Public health is not just a place of employment. It is more of a philosophy of life. So if you're concerned about the overall health of your community, if you think health is both an individual and a societal responsibility, if you think being well means more than just being physically healthy, or if you would rather prevent a problem than treat it, then you are a public health worker. No matter where you work, you can advance the health of the public by promoting programs and activities that improve the overall health of people in your community. All of us need to be public health workers because, as the Institute of Medicine said, public health is what we as a society do collectively to assure the conditions in which people can be healthy. People working together can do a lot more than individuals working alone. So today and every day, celebrate public health and celebrate your role in making our world a better place to live. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.